Hey, welcome to a new series on this channel. I'm going to be randomly educating myself on medical topics until I become a doctor. Part 1. Nosocomial fever. Nosocomial means it's hospital acquired. The most universally understood definition of a fever is anything where the human body reaches a temperature greater than 38 degrees Celsius. Within nosocomial fever, you have to be a bit more specific. If after a 24 to 48 hour time period of being in the hospital, there are at least 2 consecutive recorded cases of a fever, then it is considered to be a nosocomial hospital-acquired fever. Nosocomial fevers, unfortunately, are quite common because of the heavy presence of pyrogens, which are inflammatory markers which trigger fevers. Treating a fever, the first thing we want to know is what can cause a fever. There are 5 main causes we need to worry about. The classic one is the infection, because this is the most common one. In medicine wards, the most common is a UTI, and in ITUs, the most common is a pneumonia. After that, what else can cause a fever? Well, what can trigger inflammation? Because remember, there are 5 main pillars of inflammation, and one of them is fever. To immune diseases, inflammatory conditions like arthritis, SLEs, certain conditions which are triggered by your immune system inappropriately reacting can raise temperatures. Next thing would be malignancies. Malignancies are similar to infections in that the immune system just does not like them. They are considered foreign to the human body. It can also fight malignancies and infections, which can also trigger a fever. On top of that, malignancies themselves can trigger fevers as well, especially if they are malignancies that affect the immune system, like certain leukemias. Fourth one is ischemia. Inflammation is a process to help fight infections and promote healing, because one of the things that inflammation is very good at doing is creating vasodilation. By creating inflammation and vasodilation, we can help repair forms of ischemia. In the process of trying to promote this healing, we can also get fever as well. So patients that have come in with PEs, patients that have come in with foot ulcers which have an arterial or venous cause, they tend to have a lot more fevers in general. And finally, drug-induced. So certain medications, they are more pro-inflammatory as opposed to anti-inflammatory. And we have to review medical records and medication histories to make sure that we've not missed anything. Okay, so we've covered 5 different causes. Something you might notice with all these causes is nosocomial fevers are for people who tend to stay at hospitals more. So if a question were to ask you the risk factors for a nosocomial fever, ask yourself, what diseases make patients frequent flyers, coming to the hospital very often? So, off the top of your head, you might think foot ulcers. You might think cerebrovascular accident patients. You might think patients with CVD and MIs. You might think about patients who have a weakened immune system. All of these things can trigger a person to be at a higher risk of coming in for a nosocomial fever. So what's the management? There are some ground rules we like to stick to. One, with any fever, and actually with any disease, stick with the most basic form of getting information. Histories, examinations. After that, you can start thinking about the least invasive tests possible. Think about urine dips, think about ultrasound imaging, and think about getting basic OBS. These are not invasive and they can give you more information. After that, you might have to start thinking about getting bloods, which is invasive. But now you have to be very careful about which kind of bloods you want to get. Then after all of that, you can consider more invasive, more expensive, and time-consuming tests and imagings. Also, one more thing. To treat anything, what's better than the medicine is the prevention. And to prevent a lot of nosocomial fevers, which have been shown to have a 4-fold raise in mortality in hospital long-stay patients, well, it's simply just keeping the hospital clean and keeping yourselves clean. So make sure you stick with your guidelines. Wash your hands, be bare below the elbows, and if you are wearing jewelry, Make sure to stick to the hospital's required guidelines. Remember that it's for your patient's safety, but also for yourselves.